You do a thorough history, and sometimes you can get overlapping symptoms. So, for example, if someone said, things go blurry and I have to blink to keep them clear, the first thought is, well, that sounds a bit like a dry eye. It could also be a sign of binocular visual dysfunction, but if you get kind of filmy, cloudy kind of symptoms coming through, that's what it kind of looks like when the tear film dries up. If you get a watery eye, so what actually happens is if the oily part of your tears is not working well, you get some tear evaporation, then you get a extra additional response from the watery part of your tear, so you end up with an excessively watery eye. But if someone was saying they tend to get more double vision and things running together, then I'm going to start thinking, okay, we've got more of binocular visual dysfunction in this particular situation. And where it gets kind of a bit blurred and messy, that's when we have to then move on to, obviously doing a full assessment to kind of understand what's going on. Is the tear film looking good? How does the binocular system look? Probably another thing is, asking people, if you've used an artificial tear of a lubricant, how much relief do you get from that? And so if it's something where, look, it feels great for the rest of the day once I use a drop, then you may well be dealing with just some mild dryness that's occurring from the activity itself.
So you ask a lot of questions about the types of environments or situations they are in where they feel these kinds of symptoms. So like I guess like office air conditioning could be something that plays a
Yeah,
part in it
absolutely.
as well.
Absolutely. So air conditioning, how many hours a day are you spending? Is your tasks varied? Are you getting up and moving around, or are you doing sort of several hours straight? And what sort of device are you using? Is it something that you look at like an iPad down here, or is it up like a desktop? We might ask questions around, do you experience the same kind of symptoms if you go for a long drive? So if we're driving in the car, then we have similar kind of potentially similar environments to the office where on a long drive, we've got the air conditioning on, we're staring straight ahead. If it's a drive where we're really needing to pay attention, we're probably not blinking as much. And if so someone's getting similar symptoms in that environment, then you start to kind of go, okay, we're dealing with some sort of dry eye caused by the activity itself, or we've got signs of an underlying dry eye disease that we might need to manage.
So blurred vision could be a symptom of either digital eye strain or dry eye disease. Is that right?
Yeah, and if you look at the digital eye strain as a very global term, that could cover various things like focusing problems, eye teaming problems, and the tear film drying out and being unstable. Then both vision problems controlling your focusing and control your eye teaming and dryness both end up causing blur. And
Right.
so that's what we need to kind of tease out is where's the blur coming from? Is it from the front surface, or is it something around how you're able to actually sustain focus and sustain the two
Yeah.
eyes working together while you're doing that near work?
I think this is maybe something that a lot of people don't realize is that a dry eye condition can actually cause blurred vision, can't it? So it
Yeah.
impacts the clarity of it's not just an irritation, it's not just feeling like something like you've got a bit of sand in your eye that can actually impact on the quality of your vision as well.
Oh yeah, and you see that amplified when if you've got a contact lens wearer, and if they experience any dryness, then particularly with certain time lenses, it can really drop how clearly you see. So that kind of amplifies the problem. What I like to do is describe to people the cornea, the front surface of the eye. It actually looks like frosted glass effectively, and if we take the old way of frosting glass, where you're not using a film, you're actually etching the surface, and you put water across that etched surface, it fills in the gaps, and the water film and the glass become one optical surface, and you start to get clarity through that glass again because you've sort of provided filled in the gaps. And so the tear film on the front of the eye is very, very similar. It provides this really smooth optical surface. And so if it evaporates and disappears, you're starting to get this dry, kind of relatively rough surface, even though we consider corneas to be a lot smoother than the skin elsewhere on our body.